Hi guys, it's Zoe Russell. Welcome back to Offenders Walking Among Us, where we discuss a large range of true crime cases and uncover the psychology of it all as we take a deep dive into the DSM-5. Before we introduce the case of the week, we're going to put out a disclaimer by saying insanity is not a diagnosis, it is only a criminal defense. I will be shutting down any misconceptions by applying the following. When an accused individual is going to use the insanity defense, there are three types that they can use. The Durham rule, where criminal defendants cannot be held liable for the criminal act if it is a result of a mental disease or defect the defendant had at the time of the crime. The irresistible impulse test, which defendants can be found not guilty if they demonstrate they suffer from a mental disease or defect that made it impossible for them to resist an impulse to commit a crime. And the McNaughton rule, which states a person is not criminally responsible if they didn't know the nature or quality of their act or if they didn't know it was wrong. In the case we're analyzing today, we will be looking at the facts regarding Andrea Pia Yates, the woman who drowned all 5 of her children. But before we reach the verdict, one must present the facts. Andrea Yates was waiting for the perfect time when her husband was not around and when her extended family was not in town, as there were several attempts. On June 20th, 2001, Andrea Yates drowned all 5 of her children. But before she drowned her children, Andrea removed the mat inside the tub, turned on the water, and put up the dog. Behavior that indicates she didn't want anything to get in the way of what she was about to do. She started with the youngest child and worked her way up to the oldest. After taking the time on each child, she arranges 4 of her children on her bed, close together after drowning them, and covers them with a sheet, but she leaves her oldest son alone, face down in the tub. She then calls 911 to her residence and makes her initial confession. In the first trial, the mental evaluation of Andrea Yates would become irrelevant due to the doctor making a mistake during his expert witness testimony. He tied his findings to a Law and Order episode that Yates was known to watch. 2 weeks before the murders, an episode aired replicating what was found in Yates' home. From this, she was ultimately found guilty as the jury rejected the insanity defense and was sentenced to life in prison since she showed self-discipline when committing the acts. Out of the 10 psychiatrists and 2 psychologists, they concluded that she had no significant cognitive impairment during the drownings. She was able to dress herself that morning. She awoke the children to bid them their farewells. She remembered who each of her children were. She was able to stick to the task of drowning all 5 of them. She remembered to call the police and provide accurate information. And along with this, she called her husband's phone number. There were also mentions in the interview of her dreaming of killing her children with a gun or a knife, meaning Andrea knowingly committed these acts with premeditated intentions, though they say she is not a continued threat to society. From then on, she was just assumed to inherit catatonic or bizarre thoughts, since she was able to stand trial for 2 of her children before getting the guilty verdict overturned. Andrea Yates was given a mistrial, and the conviction was overturned as psychosis was recognized before, during, and after the crime. Psychiatrists and criminologists acknowledged the things altering her mentality, giving up her career, allowing her husband to control her in all her decisions, 5 pregnancies without proper recovery, homeschooling the children, and several others. The prosecution agreed that she was mentally ill at the time of the murders, but couldn't quite come to an agreement if she was actually mentally insane. This verdict would be the fine line between life or death, as she would either receive life in prison or get to experience her days in a psychiatric ward undergoing treatment. Andrea Yates claimed insanity and that the devil was telling her to commit these acts, but if the devil was speaking to her, wouldn't she know this to be wrong? The defense used was under the McNaughton rule and the irresistible impulse test, following the Texas Penal Code in 2 parts. These require the defendant to prove that he or she could not differentiate from right or wrong at the time of the crime, and that they suffer from mental deterioration. According to all psychiatrists, she knew it was moral, as they found 60 instances where Andrea Yates knew drowning 6-month-old Mary, 2-year-old Luke, 3-year-old Paul, 5-year-old John, and 7-year-old Noah was wrong, meaning she realistically cannot be classified by the McNaughton rule, which infers her inability to control her impulses. Mental health diagnosis is defined through the DSM-5 and uses the International Classification of Diseases codes for data collection. Andrea Yates is perceived to have postpartum depression, F53, which is ICD-10-CM, and a brief psychotic disorder, F23, with postpartum onset, which is applicable to female patients from ages 12 through 55 years. The American Psychiatric Association states that postpartum depression can be caused by changes in hormones and can be inherited, that 1 in 10 new mothers experience some degree of this, and that symptoms can include fatigue, feelings of hopelessness or depression, disrupted sleep or appetite, lack of interest in the baby, fear of harming the baby, and mood swings. Postpartum psychosis is susceptible in some women as dramatic hormonal changes in childbirth shortly afterwards episodes can result in a form of brief psychotic disorder, and it's often referred to as postpartum psychosis. Unfortunately, postpartum conditions are often misidentified and improperly treated. In many cases, it infers a mother killing her infant or committing suicide. When applying the mental health diagnosis and seeing if it is used appropriately, regarding the criteria, she appears to have the following symptoms: hallucinations and delusions, mood episodes, catatonic behavior, specifically with postpartum onset and several marked stressors within her life that could not be better explained by other disorders or substances. The sentence Andrea Yates received was 2 indictments of capital murder for the drowning deaths of 3 of her 5 children and punishment to life in prison without parole using cause numbers 880205 and 883590, which shows intentional knowledge of deaths. They originally sought the death penalty, though the jury did not implicate it. While some argue that the sentence was appropriate, some argue that she needs mental attention that will go unmonitored and without proper aid within the cell of a prison. The jury showed mercy regarding the facts, though it appears some of them should have shown greater consideration to them. On July 6, 2006, she was exonerated for insanity and committed to a state mental hospital. In my opinion, I think it is crazy that she repeatedly completed these wrongful acts without proper awareness. I think if she knew the difference between right and wrong, wouldn't she have stopped after the first few children, once realizing what she had actually done? To me, this is kind of where I see a gray area and lean towards her knowing the result of her action and feeding into a charade to get a lighter sentence. I also think part of this could be so that she could get revenge and get back at her husband. She feared him and couldn't even fathom living with him. I think maybe she wanted to take her children and herself out of the situation. But besides the fact, I still think she shouldn't have gotten away with the insanity plea, and she is definitely guilty based on the transcripts and interviews that I've analyzed. Though I wasn't sitting there on the jury and I have no say in the outcome, I think this case remains a good example of justice and mental health. What do you guys think? That is all we have today. Tune in next week for Lorena Bobbitt, the woman who cut her husband's off.